Hey there, my name is Erin Upman, and I am a registered art therapist and licensed professional counselor. I would like to tell you a little bit more about art therapy. What exactly is it, and how is it helpful? The overall definition of art therapy is that it is a mental health profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience within a psychotherapeutic relationship. That's a lot to take in. So, the simple definition of art therapy is that it is a mental health profession, similar to a social worker or a talk therapist. Art therapists usually work with individuals, families, and communities like groups. And most specifically, they focus on art making, the creative process, human experience, and the psychotherapeutic relationship. Art therapy requires a master's level degree or higher. The coursework focuses on this psychological theory. This includes a lot of research and practice, a lot of education on various art materials and ways to assist clients with using those supplies throughout art therapy sessions. The term psychological theories continues to come up, and I just want to take a little bit of time to explain what that means. In psychology, there are different branches. On the left here, we have behavioral. These focus on how behavior is learned and influenced by the environment. Next, we have cognitive. This explains how a person's thoughts and mental processes shape their behaviors. In the middle, we have humanistic theories, which emphasize personal growth, self-awareness, and human potential. Next, we have psychodynamic theories. These delve a little bit more into the unconscious forces and how early experiences shape a person's behavior. Last, we have biological theories, which link behavior to genetics, brain chemistry, and a person's physical structure. There are traditional supplies such as markers, crayons, colored pencils, paints, clays, collage. Sometimes there are different or non-traditional art materials. Maybe a session goes outside and a client needs a tree branch or a feather, fabric, or clothing from a loved one. Found a recycled object. Most importantly, an art therapy session is an open and non-judgmental space. So there are, of course, treatment goals and expectations, but there is not usually a right or wrong way for what the art should look like. As a person engages with the art supplies, they begin to feel more in control with their body and they gain autonomy and confidence. During this time, they're also able to relax their mind and relieve anxiety and depression, which overall tends to manage mental and emotional pain. Art therapy has been researched and proven effective during times of crisis, changes in circumstances, trauma, and grief. Now I want to talk to you about one of my favorite art therapy resources, which is the Expressive Therapies Continuum. This resource helps me to plan a lot of my sessions to decide which art supplies to use, what kinds of reflection questions that I should have, and how specific of a directive I need to give the clients. Today, I would like to focus more on the bottom of this continuum, which includes the kinesthetic and sensory components. We'll think about this like a scale that moves very easily back and forth, the five senses, but today we'll focus on just three of them. So we'll start with the visual component. We're going to see things and we're going to interpret them in different ways. So one of the very basic ways that we can do this is to find shapes in clouds. Also take time to make a scribble on a piece of paper and find some images within those scribbles. Another very fun way to use visual representation for art therapy is a simple emoji. So we can take a look at one of these 9 emojis and instantly we feel something just a little different just by looking. Next, we have some auditory components. We can see on the left here, there's an oil painting of waves. We might not actually be able to hear this painting, but we can most definitely imagine what it sounds like. And the image on the right side, we've got a nice seashell mobile. So this would be used with non-traditional natural found object supplies. Here we have more kinesthetic components. On the left, we see a child using their fine motor skills. So they move the objects around in the paint with some cause and effect. On the right, a picture of Arthur's fist. But I don't know how I feel. That is just so relatable. So many emotions in one fist. It's just an image, but we can most definitely tell and see what it feels like in reference. And that is all of the information that I have to share with you all today. If you have any questions, please feel free to reach out to me. Otherwise, you can find a lot of this information and more at the Art Therapy website at arttherapy.org.